All right, so today we're diving into something pretty fascinating. How the ideas of a philosopher from the 18th century are, believe it or not, still shaping the very heart of modern nursing ethics.
Right there at the bedside, in these really intense moments, nurses have to grapple with huge ethical questions every single day. And as the author Paul Kalanithi points out, it's not like a patient's values are set in stone. They shift and change during an illness, which makes navigating these ethical waters, well, that much trickier.
So that brings us to the big question. How do you truly protect a patient's dignity when what they value is a moving target? The answer, and this might surprise you, can be found in the work of a philosopher who lived more than 200 years ago.
Now, before we jump in, a really special thank you to Dr. Abdul Karim for providing all this amazing material. This whole explainer is really meant to be a high-level summary to get you thinking for the course. But we've got to stress this. This is just an introduction. It is absolutely no substitute for attending all of your classes and the nursing theory course. Okay, with that said, let's get into it.
So, who was this guy, Immanuel Kant? And why on earth are we talking about him in a nursing context? Why are his ideas so foundational?
Well, Kant was way more than just a dusty old portrait. He was a truly revolutionary thinker. He argued that moral truth isn't just a matter of opinion or feelings. He believed it's universal, and that all of us can access it just by using logic and reason.
Okay, so he developed this framework called deontology, which is basically the polar opposite of outcome-based ethics, or teleology. See, for a teleologist, the right move is the one that creates the best result for the most people. But for Kant, the most important thing was the why behind your action. The moral worth wasn't in the final score. It was in your intention, in your sense of duty.
So let's break down his ethical toolkit. There are 3 core ideas here that are just absolutely essential for nursing practice. First up is his most famous idea, the categorical imperative. It sounds really complex, but you can think of it as a 2-part test for any action you're thinking of taking. Part 1 is basically asking, could I honestly wish for everyone on the planet to act this way? And part 2, and this is huge for healthcare, is, am I treating this person with the dignity they deserve, or am I just using them as a tool to get something I want?
This leads us right to his concept of autonomy. Now, in healthcare today, we often think of autonomy as just, letting a patient choose something. But for Kant, it went so much deeper. It's about respecting a person's fundamental capacity to be their own moral authority, to actually create and live by their own moral law. And finally, we have duty. A truly moral act, Kant argued, is something you do simply because it's the right thing to do, period. Not because you're going to get praised for it, not to avoid getting in trouble, and not even because it makes you feel all warm and fuzzy inside. It's about acting from a pure respect for what's right.
Okay, so that's the theory. But how do these really abstract ideas actually work in the messy, complex, real-world setting of a clinic?
Let's look at this clinical example of Mrs. K. She's a voluntary patient. She totally understands the information about her recommended treatment, electroconvulsive therapy, but she refuses. Her choice is in direct conflict with what the medical team is recommending. So how does a nurse even begin to navigate that?
This quote from the author Jenny Diskey just hits the nail on the head, doesn't it? When a patient just feels like they're checking a box on some pre-made flowchart, is that really freedom? Is that true autonomy? It really shows the gap between a superficial choice and that deeper self-governance Kant was talking about.
So if you put on your Kantian glasses here, the whole situation looks different. The focus shifts away from how do we get the best medical outcome for Mrs. K, and it moves to what is my fundamental duty to Mrs. K as a rational, autonomous person, and that means respecting her as a person, period. It means upholding her right to decide for herself, making sure she's fully informed, and acting in a way that's fair.
These ideas don't just stop at individual patient cases. They actually shape the entire nursing profession, right down to its codes of conduct.
Just think about the language you see in nursing codes. They're filled with what Kant would have called imperatives, words like must, ought, and shall. And that language is not an accident. It reflects this deep, foundational sense of professional duty.
But here's where it gets really interesting. Look at this trend. The number of times the word must appeared in the UK's nursing code was cut by more than half in just a decade. So what does that tell us? It suggests there's maybe a shift happening in how the profession thinks about its own rules, maybe a move away from strict commands toward guiding principles.
And this raises a huge critical question for the entire profession.
Do all these rules serve as a helpful guide that clarifies a nurse's duty, or do they risk becoming a kind of cage, stifling the independent, reflective judgment that true ethical practice actually requires?
So, if these rules aren't absolute, how are we supposed to look at Kant's philosophy? I mean, it sounds pretty demanding, doesn't it?
I think the neurosurgeon Paul Culliniti gives us the perfect metaphor here. You know, in math, an asymptote is a line that a curve gets closer and closer and closer to, but it never actually touches it.
And that's really the crucial point. Kant's framework isn't about being morally perfect. It's not a destination you're supposed to arrive at. It's about the constant, endless striving toward that moral ideal. It's a process, a commitment to always reflecting and trying to improve, even when, and especially when, it feels impossible.
And that leaves us with one final thought to take with you into your coursework. For you, the modern nurse, is Kant's philosophy a rigid rulebook with only one right path, or is it a compass, a tool that provides a fixed point of reference to help you navigate the beautiful, messy, and ethically complicated world of nursing?